Hi, I'm Avery. I'm a student nurse. I'm going to be performing a head to toe assessment for you today. Can you tell me your name and date of birth?
Natalie Poole, 5/29/2003.
Okay, Natalie, can I check that on your wristband? All right. Natalie, I'm going to begin by taking some vitals for you.
Okay.
Once I get my gloves on. Okay. I'm going to start with getting your O2 saturation. And while that's going on, I'm going to also take your temperature. While you open your mouth, and put this under your tongue. Okay, her temperature is 98.6, which is regular. Her O2 saturation is 99%, which is also a normal reading. Next, I'm going to take your blood pressure. Okay, you can rest your arm. Okay.
Because it may with that, because there's a sponge actually taking up those liquids. So you're gonna deliver an IM injection. 1 milliliter is all you're giving. And so you need to choose your syringe, your needle, and your blunt tip, of course. So what do you think about when you're choosing your syringe and your needle when you're giving IM? What things do you think about?
The syringe, how much you're giving first, and then the needle, I would say how big they are and how deep you gotta go, and where, I guess, where it's at on your body.
Yeah, as far as the length. Now, the gauge, 27 or 22.
Okay, her blood pressure was 114/76. So that is within normal range for blood pressure. And then I'm going to get your pulse rate and respirations.
Okay. And how much did you say?
You're only gonna draw up a milliliter.
Okay. And are we using this again? Okay.
And so what's your angle with IM?
90.
That's a needleless,
Oh, okay.
which you need to begin with.
Okay.
That's your plastic blunt.
So it will still pull up?
Huh?
Okay.
Still pull up?
Her
I was like, what?
pulse rate is 68 beats per minute, and her respirations were 14 breaths per minute. Now, Natalie, I'm going to ask you a couple questions. Do you know where you are right now?
I'm in skills lab.
Okay, and what's today's date?
December 1st.
And what's our next holiday?
Christmas.
All right, so the patient is awake, alert, and oriented *4 to person, place, time, and event. Her face appears symmetrical, her speech is clear, and she follows commands. I'm gonna use my pen light to measure your pupil diameter. Okay, her pupils are measuring at 5 millimeters bilaterally. And now I'm going to shine the light, and I just want you to look straight ahead.
Just dump it, don't cap it.
Okay, her pupils are equally round and reactive to light and accommodation, and I see that her sclera is white.
Yep, we're dumping all that. Okay.
Now
So we're gonna
I'm
go
going
in
to
here.
check up your nose.
That right now.
And then can you open your mouth for me?
If you'll go ahead and get
All
your
right. And do you have any lesions in your mouth? Any missing teeth or dentures?
No.
Okay. And how's your hearing?
Good. No problems.
Okay. And do you use glasses or contacts?
Yes.
Okay. So the patient used glasses or contacts, and vision is intact, hearing is intact, her nose is patent, and her oral cavity is patent as well. She has no dentures or missing teeth or wounds in her mouth. I'm going to move on to assess your cardiovascular system. I'm going to start by listening to your heart in 5 landmarks with the diaphragm. And for a patient in the hospital, I'd listen under the gown. For Natalie, I'm going to allow her to keep her clothes on. We're going to start at aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and then I'm going to listen with the bell as well. At aortic, pulmonic, Erb's point, tricuspid, mitral. So heart sounds S1 and S2 were noted, and there were no additional heart sounds, no murmurs that I was able to hear. I already took her pulse rate. I'm going to take your pulses bilaterally on your hands or on your wrists. Okay, so her radial pulses are strong and equal bilaterally, and then I'm going to take her pedal pulses as well. Okay, the pedal pulses are strong and equal bilaterally. Both of her pulses are at a grade of 2, which is normal. I'm going to check capillary refill on your fingers, checking for perfusion of blood flow. And I see in her fingers that capillary refill is under 3 seconds, and I would check her toes as well and look for refill under 3 seconds. This patient is not on telemetry. Now I'm going to listen to your lungs. I'm going to start just by noting that we've already taken her O2 saturation and we got her respiration rate. She is on room air. I don't see any endotracheal tubes, no other tubes that help with breathing, and no drains in her chest. I see that her chest rise is symmetrical, and she doesn't use any accessory muscles to breathe. I am going to be listening at the front in 6 spots, and I'm just going to have you take a deep breath in and out each time you feel the stethoscope. Okay, and then I'm going to have you sit at the edge of the bed facing that way, and I'm going to listen on your back and on each of your sides. And do the same, taking a deep breath in and out.
Or just go ahead, program. Mr. Ray.
All right, I'll let you go ahead and lay that down. I heard no abnormal breath sounds, no crackling, no adventitious sounds. So that means that air is able to fill her lungs properly. I'm going to assess your gastrointestinal. I'm going to lay you down just a little bit. Can you tell me when your most recent bowel movement was?
Yesterday.
Okay, and have you been going to the bathroom regularly?
Yes.
Okay, no complications or anything?
No.
And have you had any nausea or vomiting, any diarrhea or constipation?
No.
Okay, I'm going to begin by listening to your abdomen in all 4 quadrants, starting with the right lower quadrant. The vowel sounds are present in all 4 quadrants, and I'm going to palpate, and I want you to let me know if there's any tenderness in any of these areas. Any pain or tenderness?
No.
Okay. Abdomen was soft and non-tender to palpation. I also would have observed before listening to note that the abdomen is flat, no distension. And when looking at a patient in the hospital, you'd be checking under the gown, and you might note the color and maybe even temperature of the abdomen. Now I'm going to ask you a couple questions about your voiding. Have you been going to the bathroom regularly?
Yes.
And what's the color and clarity of your urine?
Clear, yellow.
Okay, and do you feel any pain when you go?
No.
Okay. Now I'm going to assess your, before I assess your skin, I'm just going to note that there's no drains or tubes into the abdomen for gastrointestinal or gastrourinary purposes. Now I'm going to assess your skin. I'm just going to feel your arms. I'm going to feel on your ankles and your feet. Okay, so the temperature of the skin is warm in all the extremities, and there's no swelling, so no signs of edema. The color is appropriate for race. And do you have any wounds?
No.
Okay, so this patient has no wounds. If she had wounds, we would check the site and make sure that the dressing is clean and keep those dressings as fresh as we can. We would note the drainage as well. Now I'm going to check your musculoskeletal. I'm going to have you stand up and just walk to the end of the bed here. You can come back. Okay, you can go ahead and sit. I see that the patient's gait is appropriate. There's no limping, and she's able to get up without an assistive device. Now I'm going to have you squeeze my fingers. Okay, and then I'm going to have you push your feet up on my hands and down. Okay, so her hand grips are strong, her pedal pushes and pulls are strong. She has appropriate range of motion in her arms and legs, and appropriate strength. In the hospital, I would assess my patient's IV site to make sure that it's intact, it's clean, and there's no reactions going on in the skin. And I think that completes our assessment. Do you have any questions?
No.
All right.